Pay close attention. What you're about to see is Bible prophecy being fulfilled.
Welcome to another edition of YPN News, bringing you news as it relates to Bible prophecy and foretold by Israel Hawkins. Well, of course, the United States is on high alert. As we reported last time, the attacks, the riots on the U.S. Capitol. Well, there's more fears of more attacks as we draw closer to the inauguration, but not only in D.C., but in other states as well. We're going to talk a little bit about the COVID outbreak in Latin America because that is growing exponentially, and the continual surge in COVID-related deaths among both healthcare workers and everyday citizens. But first, we're going to start off regarding the United States being on high alert. The U.S. government is preparing to be attacked not by an outsider, but by its own citizens. The FBI and other departments are warning police departments to be on high alert as extremist groups and militias are planning a second assault on the U.S. Capitol along with the White House. Now, the director of the FBI is saying that he is concerned about some conversations that are being picked up online about plans for multiple armed protests.
Well, with the president-elect Joe Biden's inauguration only being a week away, national monuments have been barricaded, surrounded by National Guard troops, cement barriers, and fences. Now, Amtrak has also tightened its security, and airlines are currently not allowing passengers who are traveling to Washington, D.C. to check any firearms. Now, as a nationwide search for those involved in the Capitol riots continue, the FBI director has said that 200 of the suspects have been identified, warning more arrests are coming. And they have arrested some of those already, but they're still looking for quite a few.
Correct. Well, former NYPD Commissioner William Bratton said concerning the riots and the fear of Americans fighting Americans, he said that this is an unprecedented time that we're in, and the inauguration is an accelerant, and it will not be the end of such violence. According to the FBI director, an attack on the Capitol could be a driver of violence for armed militia groups and racist extremists who might want to disrupt the upcoming inauguration. Well, a bulletin was recently put out by the FBI warning law enforcement to be on high alert for targets such as state capitals, federal buildings, businesses, and homes of lawmakers.
Well, the Secret Service is considering closing the entire National Mall for inauguration, a space usually open to hundreds of thousands who gather to watch the ceremony. Now, much of D.C.'s businesses are closed because roads are closed to traffic, and the number of National Guards that could be deployed to D.C. could be as high as 20,000. Now, Vice President Mike Pence attended an inauguration security briefing at FEMA headquarters, and even some lawmakers who are concerned are buying bulletproof vests. So they're definitely taking what took place at the Capitol very serious and really beefing it up for the inauguration coming here in just a few days.
Correct. Well, the fear in D.C. is being felt not only there, but from coast to coast. John Miller, an NYPD Intelligence and Counterterrorism Deputy Commissioner, said in an interview with CBS News, the messaging couldn't be clearer. There is ongoing discussions about attacks on governments at all levels, and that we have to be at a heightened state of awareness and a heightened state of deployment.
Well, 10,000 LAPD, actually the entire force of the LAPD, were informed to be in uniform starting Monday through the inauguration. Now, Michigan, Ohio, Oregon, and Wisconsin among the states now using the National Guard to help protect state capitals. Now, all 56 FBI field offices have actually set up their command centers, and other federal agencies have told their officers to be on standby, and the U.S. Marshals Service is planning to deputize 3,000 to 4,000 local police officers across the country to help with the inauguration in Washington.
Yes,
so quite a force being mobilized here.
That's correct. Well, on top of those riots and threats, the coronavirus, as we've mentioned many times before, has not slowed down, with the CDC warning that the situation is so dire that as many as 90,000 Americans could die from the virus in the next 3 weeks.
Well, take a look at this upcoming video that was filmed at the U.S. Capitol on January 6th, which shows some disturbing images of a police officer being brutally attacked as the riots raged on. Take a look.
This is the moment that a police officer was filmed being pulled to the ground and beaten at the US Capitol on January 6th. A tall, shaggy-haired man wearing a camouflage-style coat can be seen carrying a flagpole bearing the US flag and smashing it repeatedly down into the space where the police officer had just been dragged. I've discovered that I spoke to this man around 25 minutes after he had allegedly assaulted the police officer. It is understood that the footage was taken at 4:27 p.m. I spoke with him at 4:53 p.m. My video provides an insight into the suspected attacker's mindset at the time. Here were his shocking words in which he called law enforcement traitors and said they should be killed.
That entire building is filled with treasonous traitors.
Yes, sir.
Death is the only remedy for what's in that building.
Well,
you need to stand up and you need to scrap. Everybody in there is a treasonous traitor. Every single one of those Capitol law enforcement officers, death is the remedy. It is the only remedy they get.
Well, that's very disturbing. You can see that it's almost really no type of reasoning with an individual who has that mindset, where he doesn't even see a peaceful solution, but he looks at everyone in the Capitol as a threat and they deserve to die.
Right, and it's gone well beyond just anger. It's turned into rage.
Yeah, he was definitely expressing that rage on that police officer. Well, Twitter has permanently suspended 70,000 accounts accused of promoting conspiracy theories or violent rhetoric, including President Donald Trump's account, saying that his tweets constituted a threat to public safety and could potentially lead to more violence. As Twitter stock fell 12% and continue to decline, lawmakers say that the platform is attacking the president's right to free speech. Even German Chancellor Angela Merkel said that legislators, not social media platforms, should regulate free speech. And the EU Commissioner Terry Breton said Capitol Hill is the 9/11 moment of social media.
Well, he also said regarding the power of social media platforms and their ability to pull the plug on certain individuals, taking them out of the realm of just being a hosting platform for free speech. He said it's not only confirmation of the power of these platforms, but it also displays a deep weakness in the way our society is organized in the digital space.
Well, many wonder why so late in the game with only 2 weeks left for the president in office. These moves should have been done sooner or not at all. Well, others say that it's a power play by big tech flexing its muscles, knowing that the president's powers on the eve of his departure are limited, and he does not have the time or ability at this point to attack the social media platforms that have launched a full-scale war on him.
Well, as we've been covering our own politics here in the United States and the transfer of presidents, our field correspondent Larry McGee has been looking at the nation of Israel and what they're going through right now, kind of something very similar. Larry, what's the latest here that's taking place in Israel?
Despite other newsworthy matters which are presently dominating and plaguing the headlines, it bears mentioning also that there are still ominous clouds of inevitable and great destruction looming over the Middle East. The pontifical pressure campaign against Israel's Benjamin Netanyahu appears to be subsiding somewhat, as his chief political opponent and the alternate prime minister, Benny Gantz, went on Israeli air recently to announce a shaky reconciliation between the two to allow a more collective effort in the country's battle against the plague of COVID. In America, the battle of some U.S. citizens is against their own government, as the smoldering and long-reported aggression of U.S. extremist groups ignited forth from the closeted and disregarded inequities and injustices of the socio-economic sphere onto the worldwide political stage with stunning rage and violence this week. America's competitors are scrambling to seize the opportunity, including China, who is strongly promoting a prosperous, polished, and poised image of itself and their philosophy in the midst of American chaos. Analysts report that behind the rose bushes, however, are problems as crushing as those at work in the U.S., including an ongoing fight with COVID and demographic blowback from its population control policies, which are reported to have severely handicapped the country's ability to domestically populate and grow its economy. Analysts say that all of this is being concealed by Beijing through dishonesty. In addition to other parts of the world, the plague is also making its way through Latin America. The president of Chile recently entered quarantine after a member of his staff tested positive for the affliction. The case is the same in Chile, Peru, and Brazil as it is in the world at large, with healthcare officials sending out warnings of an impending collapse as they struggle to assist the growing numbers of people afflicted with the virus that is projected to infect billions. In Malaysia, the government is attempting to project confidence, but has nonetheless had to declare a state of national emergency regarding the virus and tighten restrictions after experiencing a 5-fold increase in their numbers of confirmed infections. For YPN News, I'm Larry McGee. Katan Jeff, back to you.
Well, these issues are definitely not limited to the United States, not only in the realm of politics, but also as we're seeing in Latin America, as there's been a huge surge in the COVID-19 cases there as well. Well, we're going to turn to not so far down, but just south of our border here in the United States to Mexico now, where the pandemic is bringing healthcare workers to their breaking point. And as we have reported in many other countries, the crisis, while still getting worse, is hitting those in the medical profession the hardest. According to the Mexican government, nearly 2,500 healthcare workers employed nationwide have lost their lives since the beginning of the pandemic.
Well, doctors and nurses from the National Public Health Services are so desperate they have taken to social media to implore citizens to take corona seriously because they can't take much more. Now, in the video, the medical professionals explain how physically and emotionally draining the pandemic has become. One doctor even pleading, "We're begging you, do not expose yourself to contagion. Don't become a transmitter of the disease." So pleading with the citizens, stay away from somebody if you know they're sick, and just begging them not to be another one coming in there because they're already overwhelmed.
Yeah, because as one person has to deal with their own COVID-19 case, these doctors and nurses are dealing with hundreds, if not thousands. So they're greatly affected, not only physically, but emotionally and psychologically as well. Well, Mexico has been one of the hardest hit by COVID-19. The nation's economy is also suffering. Many small business owners are now bankrupt and standing in the unemployment lines. This is also causing a ripple effect because those businesses like bars and restaurants had many suppliers who now have no one to sell their products to.
Well, the government has reinstated a partial lockdown in Mexico City, hoping to slow the spread of the virus, but so far, daily death tolls and new infections keep skyrocketing and pushing hospitals to their limits. Now, France has been taking serious measure against coronavirus, including keeping the border closed with the UK except for essential travel. Curfews across much of the region, and bars, restaurants, and places of culture are still not in full operation.
Now, the Prime Minister did not have a great report for the French people this week, stating, "The time hasn't come to return to normal. We still admit one person to intensive care every 7 minutes, and one person in 2 people in intensive care are there for COVID-19. Well, more curfews are being imposed, and earlier as well. Most are 8, but some are being set at 6 p.m. And it doesn't look like the social business, or the local business, will be opening back up fully until at least mid-February now.
Well, back here in the United States, things are not improving. In fact, the daily death tolls are still continuing to climb to new highs. Now, the latest 24-hour period has seen the loss of 4,279 Americans. The new strain of COVID that has been found to be more easily spread has been reported in 8 states, and the economic situation isn't getting better either. Now, 140,000 jobs were lost in the month of December, while the unemployment rate stayed around or at 6.7%.
Well, as we've been reporting over the past few months, the U.S. healthcare system is also being pushed to overwhelming burdening limits. To add to the dire scenario, the country reported 23,000 deaths this week alone, which is the most deaths for 1 week since the pandemic began.
Well, in Los Angeles County, the situation there is extreme. 1 in 3 people have been infected with COVID-19, and 1 person dies every 6 minutes with the infection. Now, 4 out of every 5 people that the EMTs rush to the hospital are positive with COVID, and sometimes they wait with patients in the ambulance anywhere from 6 to 10 hours before they bring them into the hospital. Just for clarification there, they're not dying from the COVID, but it's from the complications that resulted from them catching COVID-19.
COVID related. Okay. But the hospitals aren't the only place being overloaded and overwhelmed. The morgues are too. The National Guard has been called to LA County to help store all the deceased in refrigerated units until they can be taken care of. On top of all this, there are the extremely long waits for those who want to get vaccinated. California's rollout is moving slow at best, using less than 30% of its vaccine supply with the first round of doses.
Well, the urgency to vaccinate is growing as the new variant spreads and fears of more mutations of the coronavirus could arise. A CBS medical contributor, Dr. David Agus, says the more we vaccinate, the less virus in the country, the less chance of getting newer strains that could cause more problems, end quote. Well, what kind of problems? Well, from experience, experts see there is potential for the virus to become resistant to some vaccines, or strains could even become more infectious, like the variants first detected in the UK and South Africa. And of course, that is a very big concern because, as we've seen with other diseases, just when the doctors and the scientists think they have a vaccine for it, it mutates, and that is basically becomes ineffective.
Yes, and we've already seen at least one mutation of the COVID-19 virus before the vaccines were even fully developed and started to be publicly given out to the people. So what will take place as a result of the vaccines and new mutations is yet to be seen. Well, Dr. Agus also explained how a virus can be more contagious. He says what it means, that is what more contagious means, is if before it took, say, 1,000 particles for you to spread the virus to me, and it took about 10 minutes for you to expel enough particles to reach me, now that will happen in 5 minutes with half the number of particles, and that's what worries us.
Well, the CDC has predicted that over the next 3 weeks, 90,000 Americans could die due to complications from COVID. Now, we have seen the virus spike in cities across the country from now, and now the last 7 days have been the deadliest of the entire pandemic. Among the hardest hit states right now is Arizona. Now, Dr. Jennifer O'Hay describes her hospital to CBS Evening News, saying it's a war zone. It is chaotic sadness. Now, things have gone from bad to worse after the new surge this fall and winter.
Dr. Keith Frey, the CEO of Dignity Health, stated, we're in the hottest spot in the U.S. and among the hottest spots in the entire world. Dr. O'Hay is struggling to treat everyone in her care, saying, I worry that I won't get to a patient in time, and sometimes I haven't. It's terrible. It's the most heartbreaking thing we do.
Well, mega sites have been set up for vaccinations, like at Disneyland in Florida and the Javits Center in New York, where they are booked through March. Now, some are looking for new solutions and hoping the answer lies in Johnson & Johnson's new single-dose vaccine. They are awaiting test results, but also having production issues. Now, there seems to be actually no true relief in sight from coronavirus, and Dr. O'Hay sums up the medical profession's feelings very well, explaining, we are breaking. physically and emotionally, we've never dealt with this much death, and that stuff, it's etched on our souls every day, she said.
Yeah, and that's interesting because, like we've reported previously, some of the medical professionals have said that this coronavirus is basically the new normal, and we need to be prepared to pretty much just live with this as we would the common cold or flu, because it's not going anywhere.
Right, and as we see now with the medical profession, how they're very overwhelmed at this point, and everybody hopes that this vaccination, and they use that word hopes because they really don't have any other hope, so they're trying to put it in the vaccine, which hasn't been effective, as we've reported, but they're hoping this is going to turn around. But if they look at the other side and see that it's picking up, as the statistics show, there's not just going to be this amount of death they're dealing with, but even more and more on top of that. So they're already overwhelmed. Just think how much more they're going to be overwhelmed if this continues. The pattern that we've been seeing in the surges, the spikes in death, but also the hospitalizations, as we've talked about, the ICUs are pretty much full in many hospitals, and they're having to do makeshift ICUs, makeshift beds, if you would, to try to help COVID-19 patients. So only getting worse. And of course, we know that Yeshua Hawkins from the House of Yahweh has been explaining these things step by step, and everything he has said so far right in line with what we are seeing take place in the news today. So if you'd like to learn more about these stories, contact the House of Yahweh. And when you do, don't forget to request your free copy of the Prophetic Word magazine and monthly newsletter. Here's how.
To contact the House of Yahweh, you can write them at the House of Yahweh, P.O. Box 2498, Abilene, Texas 79604. You can call them at 1-800-613-9494. Or visit them on any of their websites by going to Yahweh.com, YisraelHawkins.com, and Yahweh'sBranch.com. You can visit our website by going to YPNnews.com. You can email the House of Yahweh at info@yahweh.com. And for all calls outside the United States, please dial the number on your screen. And of course, don't forget the perfect aid to aid you in understanding and reading along and understanding the prophecies in your scriptures, the Yisrael Says and the Ask Yisrael programs, both free and available online. You can find those by going to YisraelSays.com and AskYisrael.com.
Well, these can be pretty fearful times in very uncertain times, unless you have certain information given by one man. Up next is Yeshua Hawkins. You won't want to miss this message. For all of us here at YPN News, I'm Jeffrey Heimerman.
And I'm Katan Alexander.
Thanks for watching.